Hi. This morning I want to talk about sensorimotor obsessive compulsive disorder, which is something that I've been sort of dealing with for a couple of years. So that's where you become overly focused on a process that your body just does naturally. So it could be swallowing or breathing or your heartbeat. So in my particular case, I become very focused on my breathing to the point where it sort of dominates my thoughts, and then I become worried that if I stop thinking about my breathing, I'll stop breathing, which is obviously now in the cold light of day irrational because it's a reflex action. So I've been to see the doctor for anxiety. I've had cognitive behavioural therapy to help with sort of dealing with anxiety and kind of unhelpful thoughts, but it hasn't solved this problem with my breathing. And having read a bit online, it looks like actually CBT is not the right treatment for sensorimotor OCD, which is a kind of a specific form of OCD. And really I thought I just wanted to sort of put something out there because I haven't spoken to that many people who are in a similar position to me or feel the same as me, and it'd be useful to just have some feedback or have people comment on what's helped them. So what I find particularly difficult is particularly when I'm trying to go to sleep, I will be focused on my breathing, and then as I'm drifting off to sleep, quite often my attention will snap back to my breathing, which wakes me up. It's like a jolt and gives a jolt of adrenaline, or I'll be sort of, my mind will wander, and then I'll become conscious of my breathing again, but in a slightly more subtle way. But again, it will wake me up and it will keep me awake until basically I'm exhausted, and then I just fall asleep. And once I'm asleep, generally, I'll get some sleep, maybe sort of 5 hours or something, which is probably enough, right? So this has been happening for years, so I'm obviously functioning, and I'm still here. But that doesn't stop the fact that every night feels a bit like a battle. Like sleep feels like a sentence rather than something I should enjoy. And in particular, I think what I find hard is, every night I'm having the same thoughts that maybe I'm going to stop breathing. Oh, it's getting worse. It's getting worse. And then, in the cold light of day, it just seems ridiculous. So I've tried all sorts of coping strategies and, herbal teas. I did try some medicine, some citalopram, but that actually just made me very ill. I didn't sleep for 3 days, so I stopped taking that. I've had hypnotherapy, CBT, lots of different things, but nothing's quite worked. And from what I've read, actually, with this sort of OCD, there's really exposure's the only way to kind of tackle the problem. So I've tried mindfulness before and meditation, but I find that difficult because I have to focus on my breathing, which is exactly what I don't want to do. So I'm going to give that another try this week. I'm going to actually try and meditate at least once a day, and I'm also going to kind of try and cut out any alcohol or wine, or in fact, like herbal tablets, like things with valerian in, which I've also tried, which helps. To be honest, it helps. It kind of those kind of herbal remedies, that they do make a difference. It seems better than nothing, but maybe I just need to just have nothing, no help whatsoever, and just actually, if I don't sleep, realize that that's okay. And so that's it for now. I just thought I'd introduce my symptoms and what I've been dealing with, and then maybe if anyone else has got anything to say in terms of what's helped them, that'd be useful. And I can share the things that have helped me, which On a general anxiety level, which I'll talk about potentially in some other videos, I've done lots of things that actually have helped on a sort of day-to-day basis. So actually my anxiety during the day is pretty good and manageable, but I think it's the nights that I really need to deal with, and this kind of obsessive kind of just focusing on my breathing. Anyway, that's it for now.